Good morning to all. I am Gothaiammal, working as Assistant Professor in Department of Microbiology. Today we are discuss about the Plasmodium. It is the causative agent of malaria. This presentation explains the biology, life cycle, pathogenesis, diagnosis, treatment and prevention of Plasmodium, the parasite responsible for malaria. Introduction. Plasmodium is a protozoan parasite that causes the malaria in humans. It is transmitted through the bite of an infected female Anopheles mosquito. Malaria remains a major public health problem, particularly in tropical and subtropical regions of the world. The parasites primarily infects liver cells and red blood cells in humans. Next we see about the classification. Plasmodium belongs to the kingdom Protista, phylum Apicomplexa and class Sporozoa. The genus Plasmodium includes several species that infect humans such as Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, Plasmodium ovale and Plasmodium novelzi. Among these, Plasmodium falciparum is the most dangerous and causes severe malaria. Next, morphology. Plasmodium exists in different morphological stages during its life cycle. These stages include the sporozoite, merozoite, tropozoite, it is the ring stage, zygont and hamatocytes. The parasites lives and multiplies inside human liver cells and red blood cells during infection. Next, life cycle. The overview of the life cycle of Plasmodium. It requires two hosts, namely human and the female Anopheles mosquito. Humans serve as the intermediate host where asexual reproduction occurs, while the mosquito acts as a definitive host where sexual reproduction takes place. The major stages include sporozoite, liver stage, blood stage, hamatocytes and mosquito stage. This is the diagrammatic explanation of the life cycle in humans and mosquito. Life cycle in humans. When an infected mosquito bites a human, sporozoites enter the bloodstream and quickly reach the liver. Inside liver cells, the parasites multiply and release merozoites into the bloodstream. These merozoites infected red blood cells develop into tropozoites and zygont and eventually rupture the cell to release more parasites. Some parasites develop into gametocytes which are infective to mosquitoes. Life cycle in mosquito. When a mosquito feeds off an infected human, it ingests gametocytes along with blood. Inside the mosquito's gut, gametocytes develop into male and female gametes that fuse to form a zygote. The zygote develops into ookinete which forms an oocytes in the mosquito gut wall. The oocytes produce sporozoites that migrate to the salivary glands ready to infect another human host. Next, pathogenesis. The disease symptoms of malaria mainly result from the destruction of red blood cells by the parasites. The rupture of infected cells release toxins that trigger fever and chills. Severe infection, particularly with Plasmodium falciparum, may lead to complications such as cerebral malaria, organ failure and even death if untreated. Clinical symptoms. The common symptoms of malaria include periodic fever with chills and sweating, headache, nausea, vomiting, fatigue and anemia. Patients may also develop an enlarged spleen due to the destruction of red blood cells. Diagnosis. Malaria is commonly diagnosed by microscopic examination of stained blood smears, which remains the gold standard method. Rapid diagnostic tests are also widely used for quick detection of malaria antigens. Advanced laboratory methods such as PCR is nothing but it is a polymerase chain reaction, can provide highly accurate diagnosis. Treatment. Malaria can be used using anti-malarial drugs such as chloroquine, artemisinin based combination therapy and primaquine. The choice of treatment depends on the Plasmodium species, severity of infection and drug resistant patterns. Next we can see about the prevention and control of Plasmodium, especially in malaria. Malaria prevention mainly focus on controlling mosquito population and avoiding mosquito bites. Preventive measures include the use of insecticide treated bed nets, indoor residual spraying, and elimination of stagnant water sources. Preventive medications and vaccines are also available in some regions. Complications. If malaria not treated promptly, it may lead to serious complications such as cerebral malaria, severe anemia, kidney failure, respiratory distress, and death, especially in vulnerable population like children and pregnant women. Plasmodium is a life-threatening parasite responsible for malaria, which continues to affect millions of people worldwide. Early diagnosis, effective treatment, and preventive strategies are essential to reduce the burden of this disease. Thank you for watching this session. Thank you.